In this video, we're going to do an overview of how we can make it easy for providers in our referral network to send us referrals and have them automatically go through our specialist providers' rules. That way we can get more referrals and see exactly the patients we want to see, all automatically. On the right side here will be the specialist, and on the left side will be the primary care office. To show you how easy it is for the primary care office to send us referrals, we'll do that first. So we'll click Create Referral. We'll enter some basic patient demographic information. We'll enter the patient's insurance. And the specialty we'd like to refer to. We'll refer to spine surgery. We can also attach any files or anything like that, and they'll be automatically sent to us as the specialist. We'll then answer some specialty-specific questions. And as a specialist, these are the questions we're able to build any kind of rule on. Is the patient willing and medically able to consider surgery? Yes. Has the patient had an MRI? MRI shows nerve impingement. Suspected problem? Nerve impingement due to disc herniation. Does the patient have arm or leg pain? No. And has the problem been treated? And the patient has had conservative treatment, including physical therapy, chiropractic, etc. Then we'll click Continue. If the location of the patient and the insurance network of the patient and the way the questions have been answered match our rules, then we'll show up as a specialist in the results. And the primary care office or the patient can then go ahead and choose the time that works best for them. Maybe 11:30 a.m. tomorrow. The referring side or the patient will then see confirmation, any pre-appointment instructions, and directions to our office. We can also, they can also enter their email, home phone, or cell phone to receive confirmation and reminders. That way they're less likely to no-show. And then it's done. Now on our receiving side, as the specialist, we can see that we've received a new referral. We can see that they have Blue Cross Blue Shield of Colorado. We can check out their questionnaire. Now, if we wanted to set up some rules around our referrals, that way we can make sure we're seeing exactly the patients we want to see, we can do that here. So we can create a rule that says if the patient's answer to whether they're willing or medically able to have surgery is no, well, we as a surgeon don't really want to see them, so we'll go ahead and automatically reject the referral. That way we won't even show up in the results. Let's create another rule. If the patient's answer to has the patient had an MRI and the MRI shows disc herniation, and the patient's answer to has the problem been treated is that it's already had conservative treatment, then we'll assign a high priority. We know we want to see that patient. They almost certainly require surgery. The sky is really the limit on the rules we can create, and this is one of the ways that Preferral is different than ZocDoc and caters especially to those specialties that don't want to see just any patient off the street who wants the ability to self-refer themselves or may not have already gone through an interview process. With these rules, we can automate that interviewing process and make sure that we can improve that new patient to surgery ratio and make it very easy for specialists to see exactly the patients they want to see, while at the same time making it easy for patients to come into their clinic.